If someone reports worsening vision, double vision, trouble chewing or swallowing, or trouble with slurred speech, we might want to spend more time on the cranial nerve exam.
We'll teach you a basic cranial nerve exam. We rarely test cranial nerve 1, the olfactory nerve. We're skipping it now, and we'll show you how to test cranial nerves 2 through 12. I'd like to check different nerves for muscle strength and sensation. All right, I'd now like to check your vision. We'll use this card. I'll have you hold it 14 inches from your nose, cover one eye, and read the smallest line of numbers that you can.
5, 2, 5, 9, 8, 3.
Now I'll have you cover the other eye and read the smallest line of numbers that you can.
3, 7, 2, 8, 4, 6.
Thank you. I'm now going to check how your eyes move. I'll have you remove your glasses for a moment. I'll have you look right here at my finger, and you're going to follow it with just your eyes. Do your best not to move your head. You can put your glasses back on. I'd now like to check your peripheral vision. I'll have you cover one eye and look right at my nose. What side do you see wiggling?
That side. That side. Both sides.
All right, switch eyes. Cover your right eye. Look right here at my nose. What side do you see wiggling?
That side. That side. Both sides.
Perfect. I'm going to check your eyes again using this light. I'll have you remove your glasses. Keep looking right at my nose. I'm going to shine a bright light. All right, you can put your glasses back on. I'd now like to test the sensation in your face. I'm going to use my hands. Does this feel about the same on both sides?
Yes.
Does this feel about the same on both sides?
Yes.
About the same on both sides?
Yes.
We're now going to test your facial movements. Show me your teeth. Close your eyes really tight. You can open them. Thank you. All right, I'm now going to check your hearing. I'll have you close your eyes. What side do you hear fingers? All right, stick out your tongue and open your mouth and say, ah.
Ah.
Doing. Shrug up your shoulders.
Come back to BU Neuro for more learning.